My name is Akello. I'm an associate professor of medical anthropology. In this pandemic preparedness workshop and pandemic preparedness project funded by Wellcome Trust, I am co-investigator based in Uganda. I have done a 21-month ethnographic study in the sites of Wakiso, Gulu, Kasese, Entebbe, and Kampala districts. In these study sites, we interview different people. For instance, in the upcountry districts of Kasese and Gulu, we interview villagers. And in the district hubs of Wakiso, Entebbe, and Kampala, we interview policymakers and global health partners. The global health partners include WHO, CDC Africa, CDC USA, MSF, Baylor Uganda, Uganda Red Cross workers. In the various pharmaceutical companies, we'll interview key players in bringing the drugs into Uganda, including those at the National Drugs Authority. There are key findings in this ethnographic study. For instance, in the villages, the disease has been viewed as asymptomatic, mild, and mostly a disease of the radio and the disease of the TV. At policy level, although our policymakers work with global health partners, there are various disconnects, disjunctures, and various contradictions in the interventions and pandemic preparedness. For instance, the clinicians have been instructed over the years to admit asymptomatic patients to offer non-traditional clinical care. Concerning vaccines for COVID-19, there was a general hesitancy when this vaccine was introduced. For instance, villagers viewed it as another attempt to control and exert power over them. The clinicians also and policymakers questioned the efficacy and the necessity to introduce the vaccines into Ugandan population who have mostly experienced the disease as mild and asymptomatic. This prompted the global health partners to introduce and to fund the campaign mode for COVID-19 vaccines. In the campaign mode, the vaccine could be extracted from the routine parts, whereby the vaccines are delivered to hospitals. In this way, in the campaign mode, the vaccines were instead delivered at funeral places, at playgrounds, at district meetings, and in churches, just to encourage people to take the vaccine. But there was still general hesitancy because people did not see why they needed to take a vaccine which is for a disease which is only mild and asymptomatic. This gives an indication that there are various power relations in global health practice. For instance, there is huge power difference between the global health partners' agenda and also what the local partners and local people want and need. Therefore, this calls for an urgent decolonization of global health.